Welcome. Today, we're shedding light on Microtia, a congenital ear malformation that affects thousands of individuals worldwide. We'll explore what causes it, how it develops, what to look out for, and the options available for treatment and support. The exact cause of Microtia is often multifactorial, meaning it's influenced by a combination of genetic and environmental factors. In some cases, specific genes have been identified as playing a role, but more often than not, it appears to be a complex interaction. Environmental factors that may increase the risk include certain medications taken during pregnancy, such as isotretinoin, maternal diabetes, and potentially exposure to certain chemicals or viruses. However, in many instances, the cause remains unknown. The development of Microtia occurs very early in pregnancy, during the first trimester, specifically between the 3rd and 8th weeks of gestation. This is when the external ear, or pinna, is forming. Microtia arises when the normal development process is disrupted, leading to an underdeveloped or malformed ear. The severity can range from a slightly smaller ear to a complete absence of the external ear structure. Microtia affects an estimated 1 in every 6,000 to 12,000 births, making it a relatively rare condition. It occurs more frequently in males than females, and is also more common in individuals of Hispanic, Asian, and Native American descent. While it can occur in one ear, known as unilateral Microtia, it can also affect both ears, called bilateral Microtia. The prevalence varies depending on the geographic location and ethnic background of the population. The signs and symptoms of Microtia primarily involve the appearance of the ear. As mentioned, this can range from a slightly smaller than normal ear with some typical features to a severely underdeveloped or completely missing external ear. In cases of more severe Microtia, the ear canal may also be absent or severely narrowed, a condition called oral atresia. This can lead to hearing loss, which can range from mild to profound, depending on the degree of canal development. In some instances, other facial abnormalities may be present as well. Diagnosis of Microtia is usually made at birth during a physical examination. The appearance of the ear is typically sufficient for diagnosis. However, further testing, such as audiometry to assess hearing and imaging studies like CT scans, may be performed to evaluate the inner and middle ear structures, especially if oral atresia is suspected. Genetic testing may also be considered, particularly if there is a family history of Microtia or other related conditions. Microtia is often classified based on the degree of ear development. Grade I Microtia involves a slightly smaller ear with mostly normal structures. Grade V Microtia presents with a partially formed ear with some recognizable features. Grade C Microtia indicates a small, peanut-shaped structure with no normal ear structures. And finally, Grade IV is characterized by a complete absence of the external ear, also known as anotia. Treatment and management of Microtia are highly individualized and depend on the severity of the condition, as well as the presence of oral atresia and hearing loss. Treatment options can include reconstructive surgery to create a new ear, using either cartilage from the patient's ribs or a synthetic implant. Hearing loss can be addressed with hearing aids, bone-anchored hearing aids, or other assistive listening devices. Early intervention is key, particularly for hearing loss, to ensure proper speech and language development. A multidisciplinary team including surgeons, audiologists, and therapists is essential for comprehensive care. Currently, there's no known way to completely prevent Microtia, given the complex interplay of genetic and environmental factors. However, pregnant women can take steps to minimize potential risks, such as avoiding medications known to be associated with Microtia, managing pre-existing conditions like diabetes, and ensuring adequate prenatal care. Genetic counseling may be beneficial for families with a history of Microtia. The prognosis for individuals with Microtia is generally good, especially with early intervention and appropriate treatment. Reconstructive surgery can significantly improve the appearance of the ear, and hearing aids can effectively address hearing loss. Ongoing research is exploring new techniques for ear reconstruction and hearing restoration, including the use of tissue engineering and 3D printing. These advancements hold promise for even better outcomes in the future.